This pea soup makes me nervous.
How you feeling?
Overworked and no dinner. Damn long day.
Sorry about that. I brought a sandwich along.
Right now, I'm missing a prime rib dinner meeting. Just rushing around aggravates my angina.
If you're racing against Father Time, you're gonna lose. Everything's ready. Have the oxygen filled in case we need it.
How do I eat with this mask on?
Eat now, breathe later.
Ah, coffee. That's what keeps me going these days.
I had to quit coffee. Too much stimulation.
We need clearance for you.
Reservations for two, Hofstall, please?
Yes, follow me, please.
And our interest payments on our inventory loan are eating up our January profits. You weren't even listening.
What? I heard you.
Interest rates. I want to talk to you about interest rates.
Michelle, they'll fall. Trust me.
Nevertheless, we need to increase our sales beyond the targets or we're going to run into some serious liquidity problems before long.
That's why I hired you, Howard, so you can worry about it. You can take the pressure. If we don't make it, I fire you. Simple.
Your jumbo cup prime rib dinner, sir?
Right here. That looks great. I haven't had time to eat all day.
It's rich enough to kill a horse.
That's why it tastes so good.
It might be intelligent to trim some of the overhead. The interest rates, we haven't got much control there. Best to just sit it out and hope, I guess.
Trim overhead. Let's not pull back into our shell and hope the world gets better. We drive harder, persevere. We set new goals for ourselves, and you're upsetting me. I'm not feeling too good right now.
Can't handle the pressure?
Knock it off. I think he really means it.
Oh, my God. Oh, my God.
Steve, are you all right?
We got a priority 1 call.
What do we got?
Possible cardiac arrest at Kings Canyon and Clovis.
That's your turn to drive.
You can keep losing weight and never get to finish eating your food.
Well, let's go. You'll live longer eating less food anyway.
Yeah, right.
He is clear for takeoff, runway 29, IFR to Los Angeles as filed.
Roger, Roger. Departing.
Stand by. We have an emergency message. Do you have a passenger, a Thorne Parks, on board?
Yes, sir, it's for you.
They're on the phone now. Howard says it's your brother.
What's wrong with my brother?
Possible heart attack, critical condition, and he's being taken by ambulance to Valley Medical Center. That's all. Do you want to cancel your departure?
Yes, we do. Any runway left to land?
Yes, sir.
I got here as soon as the neighbors could watch Renee.
How's Steve?
I don't know. They're still working on him.
Is Mom here?
She's lying down.
Steve's had a coronary and he arrested, but he's stable now.
When I almost left town, what next?
Well, frankly, it's touch and go.
Is he gonna make it, Doctor?
Well, we're doing everything we can, but it was a very serious heart attack and it may require surgery.
Mother, I know. Same as Father had.
Oh, honey, you're gonna have to start taking better care of yourself.
That's good advice.
My brother is so young. Why did this happen?
Well, he probably had a narrowing of the artery and a sudden closure during dinner.
Dr. Fram to the nurse's station. Dr. Fram to the nurse's station.
I'm really sorry about your brother. He's getting enzymes now to attempt to dissolve the clot.
There's nothing he could have done to prevent this?
Yeah, well, maybe. If he'd taken my advice on eating, get the proper tests done he needed. You know, it's the same ones I've been after you to take.
Oh, back to those again. So what if I take your test? Then what?
Look, I've got to ride you now. You know that? That means first your grandfather, then your father, now your brother.
I know, and I've got this high blood pressure and angina.
And probably some femoral artery narrowing in your legs.
I don't like the odds.
If you were a lottery ticket, you'd be a very valuable number.
So what can we do to change this?
Get the test done like I've told you before.
I'll do it, I promise. Then what?
Well, there's no single cure, but there are options. Okay, you gotta change your lifestyle. Items like aggressive nutrition, exercise, relaxation. I mean, what I can do is give you advice and prescribe medication, but you've got to do the rest. Now, in some cases, bypass surgery or angioplasty, the balloon procedure, might be needed.
Surgery?
Well, in some cases, surgery has helped.
Like my case?
Well, we won't know until we get your test completed now, will we? Of course, there are new breakthroughs occurring all the time, new medications, new treatments.
I saw something on TV about chelation.
I don't know. I've had a few patients who claim chelation has helped them, but I haven't researched it myself.
Well, maybe I'll look into it. So what you're saying is, the cardiologist's report shows that my heart muscles are still good, but my coronary arteries might need a detour before too long.
That's right. Your coronary arteries need a better blood supply, especially during exertion.
I get the picture. Bad coronary arteries and a healthy heart.
Essentially, that's about the size of it.
And surgery is the only way to do this.
In my opinion, yes. You need the surgery to bypass the arterial plaques right in there.
Well, why not just scrape out my arteries or something?
Your legs, maybe, but the coronary arteries are much too small for the procedure you're referring to. Sometimes the balloon treatment is used for localized narrowing.
Well, isn't there some diet or medication I can take to dissolve the plaques in all my arteries?
I just don't think it would be effective in your case. However, you may have to continue medication after the bypass.
But I thought the surgery was supposed to clear it up.
Sometimes the bypass vessels clog up with calcium, cholesterol, other debris. When that happens, re-bypass is necessary.
How long before that could happen?
Oh, 3 to 5 years, maybe longer.
That's not very long after all this. What about my legs and all my other arteries?
You may have to have them done too later.
I can see one bypass after another.
Could happen that way.
Dr. Fram to the nurse's station.
I'm going to bypass the bypass for now. I don't really feel that bad. I'm going to cut some bad habits first.
That wouldn't do you any harm.
Impressive, if it's for somebody else.
All the very latest equipment.
These kidneys are nice. Those two ladies are not a donor. There's a cause right here, eh? The coronary arteries are clogged. They're severely narrowed, and there's an acute coronary thrombosis in the left arterial descendant artery.
Massive infarction?
Now, this is a blood clot that killed him.
His personal habits were stupid for a man so brilliant in electronic engineering.
Didn't he know any better?
Sure he did. Looks like widespread arteriosclerosis. He was only 38. I repeatedly warned him. Long hours, job stress, weight gain, and his divorce. His cholesterol, well, it really wasn't that high. Man smoked 2 packs a day.
I figured him for a 2-packer, man. As soon as I saw his black lungs, the stress and the average man's diet today, it just kills him.
He never took a prudent diet to heart.
Oh, exactly where I think he did take it.
Always racing the clock.
That's what we do all the time around here. Unbelievable. 80-year-old arteries in a 38-year-old man.
So that's what they found on the autopsy of my brother.
Yeah. Why don't you continue your medication, Mr. Parks? It'll reduce the chances of any rhythm disorder of the heart.
What about the low-dose aspirin?
Yeah, that'll lower the chance of any coronary thrombosis.
Is aspirin approved for that purpose?
Yes, it is now. Like many drugs in the past, it was used purely at the discretion of the doctor, but it's all right now. So why don't you finish getting dressed, and I'll come back and see you in a second. I think you're going to have to learn to relax more.
Well, there's only one person relaxed at a funeral, Doctor.
It's been a tough time for you. I lost my father not too long ago. I know.
Before I go, there was something else I wanted to ask you.
Sure.
It's just something I heard about, and I wanted your opinion. Chelation therapy?
I've read a little about it. It's my opinion at this time that'd be a waste of time and money.
Oh, it's my time and money.
Well, it's just not widely practiced right now.
Can you refer me to someone?
I'm not referring anyone for chelation therapy.
What about my diet? I mean, I've given up smoking, but there has to be more I can do.
I want to put you on a low-fat, low-cholesterol diet.
What does that mean, Daddy?
A lot less red meat, fewer eggs, no French fries.
I can't live without French fries.
I can't live with them. Well, tell me what else I can do.
Moderate exercise.
I'll start walking more.
And on your way out, Ab, my nurse, set you up for an appointment to see me in several months.
And again, and again.
Yes, as long as I'm going to be helping keep you alive, I'd like to see you.
Okay. Thanks, Doctor.
See ya.
Daddy, we're going to be late for my piano lessons.
Oh, that's right. Come on, get over. I'm really worried about my heart. I can tell it's not improving. Sometimes it really hurts.
Well, at least you're serious about canning those cigarettes. I'm sorry it took this to convince you.
I know.
They're doing an awful lot of bypass surgeries these days.
I'd think about it if I were bad enough.
You've got to do something.
Daddy, you're not going to die like Uncle Steve, are you?
No, sweetheart, he isn't.
One more, Thorne. Come on, one more. Give me a good one. Come on, one more, buddy.
Oh, knock it off, Matt.
Oh, what's wrong with you today? You seem really somber.
You know what happened, and I've seen too many doctors lately.
Yeah. Yeah, I understand. And I'm sorry, huh?
I've given so many specimens lately. Yesterday at home when I had to go, I grabbed an empty bottle out of instinct.
You know, it's not just that, Thorne. You seem kind of preoccupied.
I'm trying to read up on something called chelation therapy.
Yeah? What do you want to know about it?
You? My doctors don't even know much about it.
They're treating my father with chelation right now. There's some kind of circulation problem in his legs.
You're kidding. I don't believe it.
Yeah, you ever heard of claudication? It's arteriosclerosis of the arteries in the legs.
Not that. It's the fact that you know about chelation therapy.
It's not the sort of thing that pops up in our conversations every day now, is it?
Is it any good?
My father thinks it is. And his improvement is obvious.
Who's giving the treatments?
Tell you what, we're through lifting. We'll go get some coffee. I'll get you the doctor's name and number.
Okay, great.
Next set. Well, now, how do you like that? Thorne, this is Dr. Farley, the physician that's treating my father by chelation. Doctor, he's been asking me all about it. Do you mind if we join you?
No, have a seat.
Sounds like a wonder cure.
Chelation therapy is only a part of the whole program I prescribe to help reverse the vascular disorder.
Is the therapy safe?
It has a very fine safety record, established by over 1,000 doctors in practice the past 30 years or so.
I've got angina and some problems in my legs.
We've had a number of excellent results with angina, also hypertension and for leg circulation. In preventive medicine, we concentrate on aggressively treating the causes of the disease. We strive to reverse it before it gets out of control. This is the wrong order. I have a tuna salad, no fries.
I'm sorry, I must have switched it with the ambulance driver's order.
How do you give this chelation?
It's a simple, efficient process, administered as an IV.
Into the veins. And then I guess it gets into the arteries?
Components in the solution pick up the calcium deposits in the arteries and other tissues, flushing them out into the kidneys and, to a lesser extent, the liver.
That's all I have to do? Take some IV treatments? How can it be that easy?
It isn't, thank you.
I thought not.
Mr. Parks, your condition didn't develop overnight. Your lifestyle will have to change in certain areas.
Yeah, that doesn't mean you have to live your life as a monk.
No, but you will have to modify a bit. For example, you can't smoke.
Yeah, Thorne, I've got to run. I'll see you at the gym on Thursday.
See you, Matt.
Nice to see you again, Doctor.
Can we continue this discussion?
Sure.
Should I take any medication?
We prescribe certain oral substances along with the IV. Many of them are natural, like Arctic marine lipids, lecithin, choline, olive oil.
I've heard of those.
Along with B6 and fiber, they help reduce cholesterol and fatty deposits. You still need to watch your diet. Food is important, but the key is often the supplements. Chondroitin sulfate, lipotrophic substances like phosphatidylcholine, the elgins and mucopolysaccharides from red algae, and the fruit pectins to tie up cholesterol from reabsorbing.
Good Lord, I've never heard of these.
They help along with certain mineral and vitamin substances like niacinamide, vitamin C and E, antioxidants.
You mean I could rust out?
Rust out and wear out. Reducing this is how we obtain the results we get without surgery.
It's a combination of treatments.
Exactly. Thank you, nurse.
You're welcome.
This is a videotape of interviews that I had with former patients. You take a look at it, and I'll be back in just a minute.
Thanks, Doctor.
I think it might help you to decide.
On my legs. With just one treatment of chelation, the pain in my legs went away, the swelling went down, and now that I've had 9, I'm able to stand up and cook without sitting down on a chair, and I feel a lot better.
It's a very simple process, actually. You sit in a comfortable lounge chair for 3 or 4 hours while receiving your chelation infusion.
Certainly sounds easy enough.
You'd have to stay on a total health program if you want the results to last.
And this will help reverse my artery disease?
Some patients and conditions do respond better than others.
Thanks, Doctor.
Hello. How are you?
Fine, thank you.
Well, this certainly is homey looking.
We strive to keep the atmosphere unstressful and relaxing.
Good morning, Doctor. Is this a new patient?
No, not yet. He's just visiting. I just brought him by to meet some of the patients and view the therapy.
Pleased to meet you.
You too. Morning, Tom. How are you?
Very well, thanks. I was just trying to catch up on my reading.
I'd like you to meet Thorne Parks. He's considering chelation therapy, and I thought speaking with some of the patients would help him decide.
Sure. What would you like to know?
I think I'll just let Thorne ask that.
So how do you feel? During the session, I mean, is it painful?
Nah. Well, you might feel a little prick when they put the IV in, but compared to having your chest cut open, it's a breeze.
Have you noticed any improvements?
Sure. Heck, when I first came here, I couldn't walk 10 yards without bad angina attacks, out of breath and such.
I know what you mean.
Now I'm up to 100 yards with no angina. On top of that, I'm not winded. If I'd known about this earlier, I never would have let them cut on me. If you want to know the truth, our bypasses didn't help that much anyway.
Thanks, Tom. You take care. Hello, John. Thorne, here's someone else I'd like you to meet. This is Mrs. Morrison.
Hello.
And the arteries in her neck and brain were severely obstructed. She's had 16 treatments, and she hasn't needed her cane since the 10th treatment.
I was a mess before I started. Because of the blockage in my neck, I was dizzy all the time, always losing my balance. I used to fall a lot.
What about your legs?
Oh, that was the worst part. I couldn't walk 20 paces slowly without leg cramps. Now, I can walk at my own normal pace about 6 blocks comfortably. And my leg pains at night are gone.
That's great.
Tell me about it.
I think I've seen enough.
This is Mr. Parks. Hello, Evelyn.
Hello.
Hello, Thorne.
Hello, Doctor.
This is Mr. Parks. Like you, he wanted to speak and meet with some of the patients before deciding on chelation.
Hi. I guess I was a doubting Thomas at first, but I'm already feeling the results. I've reduced the anginal chest pain, but most of all, I've got peace of mind.
He's off much of his medication.
That's very encouraging.
I'm convinced. So much so, I even sent a book on chelation therapy to the surgeon that suggested I have a bypass. I understand he himself has some coronary disease. I hope he takes it to heart.
I wouldn't count on it, Thorne. Well, thank you. Thank you all for your cooperation. Well, give me a call if you decide on the recommended therapy, Mr. Newcomb.
All right, thank you.
Mr. Parks, you did the very thing I told you not to do.
You mean cutting down my medication?
Yes, still, I don't understand these lab results.
What do you mean?
Well, your treadmill EKG, all your tests, your blood lipids, all of them much improved. How do you explain this?
You're the doctor. And the cholesterol count, under 200?
Here it says under 170. It used to be sky high. Even your HDL protective cholesterol's better. Do you care to tell me what you're doing?
Isn't that the ideal level?
Ideal? I can't argue with these test results. If you keep improving, you're going to be able to bypass the bypass.
Doctor, may I have your signature, please?
That's the name of the book.
I'll see you again, but probably not at the hospital.
Well, continue to take your reduced medication. I don't understand how you're doing what you're doing.
He took chelation treatments.